There's a COVID risk that you may not be aware of, and it has already led to cases in Rhode Island. Katie Davis reports.
Normally, it's a great way to save gas, time, and money. But carpooling to work during the pandemic can be risky.
You need to wear a mask the whole time. That means making sure you have your mask on before you get into the car.
Joseph Wendelkin with the Department of Health says not everyone is masking up.
You shouldn't have to wear a mask with folks in your own household, right?
Yeah, thank you. That's a good clarification. So what we're really talking about here are people who are carpooling together to work.
State health leaders say Rhode Island is already seeing clusters of COVID-19 cases tied to carpools. So it's important to stick with the same group.
If people are going to be carpooling, it's really important that there's some consistency there. You want to be doing that with the same people.
Also important, keep the windows open whenever possible and stay home if you feel even a little bit sick.
You want to make sure that you're doing a symptom check before you get into the car. Really, everyone should be doing this if they're heading into a workplace to make sure that you're not experiencing any of those symptoms.
Health experts recommend that members of a small group who are often in close contact form a pod and ensure everyone in that pod maintains social distance when outside of it. And the country's top infectious disease expert is concerned about the nationwide spike in cases. Dr. Anthony Fauci voiced his concerns about the virus's effects in the upcoming holiday season. Fauci is also warning people not to model their behavior after the president.
When people say the president beat it, I'm not worried about it. What's your response?
We're very, very pleased that the president did so well when he was infected with coronavirus. But there are also a lot of people who are his age and his weight, which did not do as well as the president did.
Fauci also spoke about a potential vaccine, saying that we should know within the next few months if any of the current trial vaccines are viable. And the International Antiviral Society has updated its guidelines on the treatment and prevention of HIV. After receiving a diagnosis, patients should begin antiretroviral therapy as soon as possible. Experts are now recommending a long-acting regimen that's injected once a month. For patients at risk for HIV, the society urges the use of pre-exposure medication called PrEP. The guidelines also point out effective treatment options for patients who are pregnant or have specific medical conditions. And a new study suggests that COVID-19 infection rates among dentists are extremely low. The American Dental Association surveyed nearly 2,000 dentists from across the country in June. In all, only 20 or less than 1% had either confirmed or probable COVID-19 cases. Nearly all used enhanced infection control procedures such as screening for the virus, social distancing, and wearing face masks. Over 70% also reported using personal protective equipment.